Now we'll discuss how the ginseng play an important role in atherosclerosis, how it prevents from atherosclerosis. Before explaining how ginseng prevents from atherosclerosis, I want to explain how atherosclerosis develops. Suppose here is a blood vessel. When the blood vessel is exposed to environmental toxins, and when it is exposed to increased level of LDL cholesterol, when it is exposed to increased blood pressure and increased blood glucose level, all these factors can lead to damaging of endothelial lining in the blood vessel. When endothelial lining damage, LDL cholesterol start depositing over here. LDL cholesterol start depositing over here. LDL cholesterol give a healing effect and it start depositing over here. With the passage of time, oxidation of cholesterol starts. As the oxidation starts, monocytes come and start engulfing this LDL cholesterol and they convert into the macrophages. This process continues and it leads to plaque formation and narrowing of arteries. This was a short mechanism how atherosclerosis developed. Now we'll discuss at what point ginseng plays its role to prevent from the formation of plaque. As we discussed, this initial step in the sensitive atherosclerosis is the oxidation of LDL cholesterol. So ginseng prevents the oxidation of LDL cholesterol. Ginseng activates PPR gamma and the PPR gamma increase the expression of gene known as PON1 gene. This gene increases synthesis of enzyme Paraoxonase 1 and that Paraoxonase 1 enzyme acts as antioxidant and it prevents from the oxidation of LDL cholesterol. In this way, ginseng prevents from atherosclerosis. Atherosclerosis develops when it is exposed to environmental toxins, when it is exposed to increased LDL cholesterol and increased level of blood pressure and blood sugar, blood glucose level. So, atherosclerosis develop as a result of all these factors and when they are exposed to blood vessel that lead to damaging of endothelial lining and LDL cholesterol start depositing over here. As LDL cholesterol deposits, oxidation starts and monocytes come and start engulfing it and then monocytes convert into the macrophages and that ultimately lead to the plaque formation. So the ginseng prevents this plaque formation by inhibiting the oxidation of LDL cholesterol through enzyme Paraoxonase 1 that acts as an antioxidant and prevents from the oxidation. So now we'll discuss how it plays an important role in inflammation, how it reduces the level of inflammatory cytokines in the blood. Ginseng activates PPR gamma and the PPR gamma inhibits the expression of inflammatory cytokines like interleukin-1, tumor necrosis factor and COX-2 inhibitors. According to the research done in the Korea, 60 milligram of ginseng was given to 19 patients and for 1 year their blood sample was examined every 6 months. That significantly reduced the level of inflammatory cytokines in the blood. So the ginseng play an important role in reducing inflammatory cytokines in the blood by inhibiting the expression of inflammatory cytokines. So it also prevents from cancer by suppressing the proliferation of cancerous cells.